What's your education approach, especially considering that the amount of information patients have really makes the difference. Like we talked about, some of my patients will start taking their blood pressure medicine 3 times a week, but no apparent reason. No one said that's not on the box label. They'll just do that. What's your education approach to your patients, particularly ones who have atopic dermatitis?
Are you actually following the instructions? Because most people, when they come back, go, "Oh, you wanted me to stop the fragrances for real." And I'm like, yeah. Half of it is just reinforcing what you're saying. You got to get out of that mindset that if it doesn't lather, it doesn't work. If it doesn't smell, it doesn't clean. I mean, you want them to start to approach their life like, okay, you don't really care if you eat shrimp and you break out. If you eat weed and you break. But after a while, it's that scarring that you have to stop from occurring. Reinforcing, like, can you bring in your meds? Can I see what you've used? Did you get the meds? Things like that. And did you follow up with the allergist? Oh, I didn't think I needed one. A lot of that is education as well. And if you've done all that, then you have to have an alternative for your patient. You can't just keep them on a topical for a year and go, I hope it worked. Mm-hmm. Or come back and see me in 6 months. You need to follow up a little bit sooner and be like, let's talk. If it worked, because it's frustrating. And then after a while, some people do want immediate gratification, then find something that's a little bit more aggressive for them.
Do you have anything you want to leave us with in terms of what's typically thought of in terms of atopic dermatitis and where we're going in terms of the treatment? Anything you want to leave us with, Dr. Collette?
Treat your patients equivocally the same. If you come in, don't make an assumption about what someone has. Do your clinical write-up and do your medical history. We do not have the same skin presentation for most skin diseases. So you have to actually take your time and figure out what someone has. And if you don't know, send them to someone who would, as a referral, that can actually better help them. I hate to see people for years be untreated and undiagnosed by the wrong condition. So those, I would say, take your time to do. And at that point, fight for your patients to get medications. I fight for them to get the medication all the time. And surprisingly enough, the effort is there, and have your patients fight along with you and not just have the fight be on one side. Insurance companies will deny a doctor, but will rarely deny that patient who's paying for insurance.
I love that Dr. Collette is known for people who will be diagnosed with one thing, come in to see you and think that all hope is over, and then you'll say to them,
that wasn't it.